At this time, I'd like to yield to another good friend of mine, a true patriot to this country, one who has years and years of service. I have a tremendous amount of respect for him. My dear friend and colleague from Pennsylvania, Mr. General Scott Perry. How you doing, sir?
Well, thank you very much to my good friend from the great state of Oklahoma, and I'm privileged to have visited not only his state but his district and met the fabulous and wonderful people there, and they're lucky to have you representing him here. You talk about that statistic, and I'm here to talk specifically about mental illness, but this opioid epidemic has touched every single community. You don't have to live in a city. You don't have to live in underprivileged areas. I know very good friends that it has racked their families and it has racked our communities, and certainly one of the great things about the 21st Century Cures Act is the help that's on the way. It's probably not going to be enough, but we need to do everything we can, at least in making these first steps and wrapping our minds and our hands around this problem and getting to a solution. So I'm thankful that you've taken the time to hold a special order and bring that as well as the other issues up, and I appreciate that. I want to talk a little bit about the mental health situation in our country, and I think you've alluded to much of it in your conversation, Mr. Speaker, but more than 11 million Americans suffer from severe schizophrenia, bipolar disorder, and major depression. Yet millions, literally millions, are going without any treatment whatsoever. And these families are struggling to care for these people. You have a broken arm or some physical malady, you can see that and you can get to a cure in many, many cases. But these mental illnesses vex us, where your loved one is fine one moment and the next moment is not, and you don't know when that's going to happen, or the gravity of the situation, how bad it will be at any given moment. These are our loved ones. These are our family members and our neighbors. And the federal government's approach to mental health has been a chaotic patchwork of antiquated programs and ineffective policies spread across numerous bureaucratic agencies that simply don't get to the issue at hand, and I think we can all see that. Sadly, many patients end up in the criminal justice system or on the street because services are unavailable. I know that in the state that I reside, in the great state of Pennsylvania, years back we closed our state hospitals where much of the care was given to these people, and they just ended up out on the street or back with their families, which often cases their families just don't know what to do. They don't know how to handle it, and they can't handle it. And then these folks end up in the penal system, which is no place for people that justifiably are sick. They have an issue, that are sick. They're not criminals, but they're sick. And in the worst case scenario, some individuals commit acts of violence. And every one of us has heard the stories and seen the film footage on the news of these acts of violence can be directly attributable to mental illness. Now, we should be able to feel safe in our homes, all of us, in our communities, and our hearts just break every single time a senseless act of violence occurs, and we see that. And certainly the parents. For parents, these tragedies, they hit especially close to home. We need to remember that the beneficiaries of mental health treatment aren't only those directly treated for mental illness, but also our broader community when we see those things, those images on TV, because mental health treatment is a preventive measure to reducing acts of violence. It's a preventive measure. It actually stops those things from ever occurring if we get to it. Now, I was an enthusiastic supporter and co-sponsor of my colleague, Congressman Tim Murphy's Helping Mental Health Crisis Act. He literally worked on it for years, and I watched him struggle through that. And that bill was actually included in the 21st Century Cures Act, which passed this very House last night. This legislation coordinates programs across different agencies, those disparate agencies that don't seem to work with one another, where information is silos. It coordinates those programs, and promotes effective evidence-based programs, so we can get to solutions. And just like most other things with the federal government, by removing federal barriers to care, advancing early intervention programs, adding alternatives to institutionalization, and improving the transition from one level of care to another, we directly address our nation's broken mental health care system. Finally, a step in the right direction. So once again, I applaud and thank the gentleman from Oklahoma for allowing me this time and bringing this issue to the fore. And I urge my colleagues in the Senate to send this bill directly to the President's desk absolutely as soon as possible. We can't wait for another tragedy to occur where we're all watching on television the footage of something that could have been prevented and avoided. And with that, Mr. Chair, I yield back.
Thank you.